Following is a Sketch Media production.
Hey, bro.
Hey, man. How's it going?
Good, man.
Good to see you.
Yeah, you too. Just going to sit down and hit some topics here
Absolutely.
today, and just more of a conversation more than anything.
I love it. Nice little chat.
Yeah, most
like
definitely. All right, so let's just get this thing
Yeah, let's
started.
get it
Okay.
kicked off. What you got?
All right, man. So one of the biggest things with chiropractic is, especially somebody who's never been before, they're always saying, "Hey, once I go see you, am I always going to have to keep coming to see you?" And
I love that question.
and my face is exactly how yours was. You get that little smirk, and we all know how we like to respond. So, say you're sitting there, what are you saying to that patient?
So for me, I my first thing that pops up in my head, I was like, well, do you have to dust your house for the rest of your life? You know?
No?
Yeah, you do. You know,
Sure.
just because you get a good thorough cleaning in the house, you know, that dust is going to come back. And I kind of look at chiropractic care like that as well. It's like, yeah, you can have this injury, this issue come up, it get better,
Sure.
but life is life, full of stressful events, traumas, all these things. So it's like, you're probably going to need to get some type of tune-up, right? And that's kind of how I look at it too. It's like a tune-up for your car. You get your wheels aligned once every so often. You hit a pothole in the road. It's like, oh, well, I got to go do that again.
That maintenance.
Right. So that's the way I look at it. It's like, it's not a have to, I guess. It's more of like, once people start to actually be more in tune with their body and feel normal, they're like, oh, this is what normal feels like.
There you
I
go.
don't want to go back to feeling the way I felt.
Yeah,
And I think that's what
I
it
always
is.
say that. It's
Yeah.
one of those things, once you come in pain,
Right.
your pain dissipates, disappears. You're almost more in tune with anything, as opposed to before you might have been numb to that pain.
Right.
So you're almost hypersensitive in a way.
Yes.
And I always get the question, so how did this start? Why did I wake up with this? Why? And 90% of the time, if there's no trauma involved, it's day-to-day stressors,
Yes.
posture, sleep
Yes.
position, things of that nature. So I always rebuttal a patient when they're kind of pushing me a little, and I say, "Are you going to retire anytime soon? Is life slowing down?" No, then you got to keep up.
Gotta keep it up, yeah.
Those things are around the corner oftentimes.
Well, and that's what I'll tell. I'll have some people that they'll wait until that, you know, just dire moment where, oh, my back's killing me, I can barely move around, and that's when I stop and talk to them. I'm like, hey, look, do you realize that if we could have squeezed in this maintenance visit with you once a month even, that would eliminate us having to have 3 or 4 back-to-back-to-back visits of trying to get you back to your normal. And so to me, that's where the maintenance kind of comes in, is it possibly could save you a little bit more money on the long end, because you're taking care of it before it becomes this ultimate problem. And going back to a car, I look at it like that. If you're, you know, needing an oil change and you just keep putting that off, now the engine overheats, cracks something. Now you're looking at more than
now the big bucks.
Right. Exactly. So it's like, that's the way I look at it, is like, I'd rather pay that $100 for the oil change versus the 3-4 grand for whatever needs to be done to the engine. Right. And so that's the way I look at it for the body, is if you can keep those little things at bay, it typically won't turn into this bigger issue that has to have this extended plan visit, whatever, right?
Sure.
Just kind of keeping up with more of that maintenance.
Yep, and flare-ups are bound to happen. That's just life. It's just, if you're taking care of yourself, I say this all the time in the office, one, they're not going to be as frequent, and more often than not, they're not going to be as intense.
Yeah,
So
exactly.
it's gonna be
It
a
may
much
happen,
quicker-
but
correct, because
down.
I get the question like, hey, if I keep coming, am I never going to have a problem again? Not necessarily, but a lot easier to fix.
I wish I could promise that.
I know, right?
Absolutely. That would be a nice thing to promise, but I can't promise
guys,
that.
reality.
Because what happens, I hear these stories of, I passed out on the couch last night, and I'm like, well, if you pass out on the couch.
Arm above the head,
right,
head tilted.
I don't know what to do about that. Sorry. We'll get you back feeling better, but just try not to pass on the couch as much.
Sure. Let's talk about who can get adjusted.
Oh, I love that one. So for me, everybody and anybody that has any type of issues, even with no issues, I've actually taken my 15-month-old to get adjusted since he was 3 weeks old.
Which blows people's minds
right.
sometimes.
They're like, oh my God, are you cracking the baby's neck? I'm like, no, it's more of like sustained pressure, pinkies.
Sure.
More just checking things. And to me, that just makes more sense to grow the healthy child versus fixing the broken adult. You know?
100%. And birth itself is traumatic, especially
right.
C-sections. We won't go too deep into that, but still, trauma can start from day one.
Exactly.
So.
Exactly. And I mean, that's that. And if that never gets corrected, then to me, that's like just a trauma. And then now we have another trauma built up, and then another trauma and another trauma. And it's like, okay, now the kid is 7, 8 years old having all these issues, when to me it could have maybe been helped out early on.
Oh, sure.
And then I even see it on the opposite end. Elderly people, to me, I think a good indicator of quality of life for someone is the ability to sit to stand. I've seen so many research papers on showing the quality of being able to sit to stand directly correlating with quality of life.
That's interesting. It makes sense, though, because you see so many people, especially in the States, unfortunately, wheelchair bound, walker bound, limping everywhere they go. So if you're able to do that simple activity, that says a lot about your proprioception, your muscle strength, things of that nature.
Exactly. And so I think just even being able to provide that to someone, like, hey, we're going to be able to help you go from a sitting position to a standing position, I think that can be the world of difference for some people out there. So to me, it's anybody from young to old, in between. I think it's, what is it, from birth to earth is what what the phrase is called with it.
And elderly people too. I'm trying to think of an actual age, maybe 60 plus, but those ones are oftentimes my favorite patients because they've never been before. Oftentimes because they
respond like this.
They do. And chiropractic was viewed a little bit different back in the 80s, 70s. Not everybody went, so they're kind of coming in after years, and then they're kicking themselves. They're like, man, I wish I would have started this in my 40s or whatever it may be. So it's kind of cool to see. But yes, great to your point. Beginning to end, you can see a chiropractor your entire life. So
absolutely.
We just recently purchased a shockwave machine. So I know you've been using this on a lot of patients. I've used it on a few as well. Why don't you kind of like describe what it is and maybe some of the results you've been seeing?
So I wasn't familiar with the shockwave too much. Like, I had seen it, but until we had really gotten it, I started doing more of a deep dive research into it. And what the 3 proven things that they have researched very efficiently has been patellar tendinopathy, Achilles tendinopathy, and piriformis syndrome.
Okay, that's so 1, 2, 3, the whole pretty much lower extremities.
And so I was like, oh my God, I have so many people that come in with this knee, this ankle, this hip, and I'm like, okay, and I'm always a person. I like to, I guess, to see it to believe it, right? And so I actually had Doc come in and do it onto my calf, my foot, and Achilles. And literally first session, I was like, okay, I'm sold. This is it. This is amazing. Because I had been suffering with my foot heel pain since this time last year, getting that done. And it's been remarkably better. I've been skating better, like landing new tricks that I haven't been able to do before. So I'm like, okay.
All right, shockwave.
I know. Yeah, dude, it really kind of turned a new leaf on my like skating. So I've been really excited about it. So I've been literally any patient that's kind of coming in with like these chronic knee, ankle, hip, I'm like, we got something for you.
Sure.
And I actually have a guy coming in now. He's about 26. He had a really big mishap with his knee a long time ago. Had to do ACL surgery. I think the ACL surgery got like a little botched. So recovery wasn't the best, but he still did the PT, still recovered as best as he could. And I guess maybe it was like 4 or 5 months ago, he was out skating on it, did a little strain on it, and went to ortho, and they're like, oh yeah, we're going to need to like redo surgery.
Jeez.
And he's like, I really didn't have the best experience with the first time.
Sure.
Like, is there anything else? And they're like, well, you can try, PT, conservative kind of stuff. And so he was telling me about it, and he said the PT was kind of helping, but it just kept swelling up. Like, that was the big thing, is his knee just kept swelling up, and it was preventing him from doing the PT exercises. And so I was like, man, let's try the shockwave. I had a lot of good success with it on me. I've had another person in here with a knee issue, been using it on them. I know you've got some more issues than that other person, but let's just see. Sure enough, I mean, we're 3 sessions in.
I was going to ask how many sessions.
We're 3 sessions in, and he's back skating. Like, he literally texted me the other day. He was like, dude, I can power slide again. And that's where you like have to forcefully push the board into the ground to kind of create that stop. It's a lot of knee and ankle.
Yeah.
And so when he texted me that, I was like, that's huge, man. So he actually followed up with ortho, let him know, have been doing the shockwave therapy. The ortho was actually familiar with it, told him, hey, keep doing that. If that's working, we can push out the surgery. So he's been doing a combo of physical therapy and shockwave.
Wow, and the results are very quick. And in today's day and age, everybody wants results quickly. We've talked about this before on this podcast. we are in a generation
We want it
where
right now.
you're spending money, you
Amazon
want
Prime.
results. Correct. So when you have something like that where somebody can even experience maybe 10, 15% relief in 3 to 5 minutes, they're kind of intrigued and willing to kind of pursue that a little bit. So
I was blown
anybody
away.
with some ankle, knee, piriformis discomfort,
Yes.
shockwaves for you.
Shockwave.
Most
Come
definitely.
hit us up for it.
We've talked about this before, but so with our offices, we like to have continuity. So whether you go to our west side, east side, Duluth, no matter where you walk in, you kind of expect a certain experience. So let's talk about if somebody comes into our office, what they can expect. So just from beginning to end in a way. We don't have to go super in depth,
Yeah.
but just kind of what the vibe will be, what kind of they'll understand, especially somebody who's never been to a chiropractor.
I feel like the vibe sets for all the offices is very like this deluxe kind of spa vibe where you're getting this kind of warm greeting. You're getting to be able to talk with the doctor about the actual issue and not just kind of some, oh yeah, okay, lay down. It's like that actual kind of
Listening.
direct meeting with
Sure.
the doctor, and having just that kind of warm atmosphere of that knowledgeable person being able to kind of coach you through things, especially being new. I know a lot of times people have a lot of questions, so I'm always very happy to kind of explain stuff and be as thorough as I can and kind of explaining exactly what we're doing. To me, I think people really appreciate the education that comes along with it. So
They do.
To me, it's just kind of providing that education with the experience so they know a little bit more about their body, because to me that education is power. So.
Yep. And just listening to a patient, I always tell them that because most often patients have been somewhere else, whether be, I'm not going to single any profession out, but they don't feel heard.
Right.
So I tell them, I'm going to sit down with you in a room one-on-one and actually listen to your concerns and answer your questions. And usually if you start things off like that, they're already kind of in your corner a little bit because
like,
they're
oh.
used to being like, I've told you 10 times, you're not listening. So one of that usually always works out for me pretty well. So I just say, hey, we're going to listen to you. We're going to try our best to fix you. And if we can't, we'll get you somewhere that can. And usually they hear that and they're like, I'm intrigued.
And to me, that's the most honest way to do it.
Yeah,
It's just
transparency.
Absolutely.
Cool.
So, no, I agree with that.
This is a little random stat I found online. So over 35 million Americans are getting adjusted every year. Based on what I was reading, it's more our generation as far as that percentage, but there's a good bit in the older generation as well. How do you see that going in the future? Do you feel like more people in our generation are going to continue to get on board? Do you think chiropractic is going to decrease, increase?
I definitely see it increasing, because what I've seen across the board, even with medical, is they don't really like to prescribe the opioids anymore.
Yeah,
they really try to stay away from
constraints on it are
Very
way different.
exactly. So I feel like with pain relief, a lot of now, or the medical doctors are kind of out of the loop with it, because it's like, well, what do they have to offer now? It's like, well, that was the painkiller. Like, okay, well, what's next? Muscle relaxer. Okay, that can work
Temporary.
for a little. Right, exactly. So to me, I think a lot of that opioid care is kind of being done away with, and to me, that just opens up the door for this more natural way to feel better.
Yeah, I've even read that the VA is actually starting to, one, hire chiropractors, and two, in areas where they don't have it, they're starting to refer out, which was like a big no-no for a long time.
And
so
to me, that's a big green flag to see, okay, our government is recognizing this profession now.
Sure. Yep.
That's
Agreed.
huge.
Yeah, I 100% agree. I think that's really cool.
80% of the low back population, or 80% of the population will experience some form of low back pain.
There you go.
And when I saw that, I was like, 80, that's a lot of people. And so I started thinking, I'm like, well, if 80% of these people are going to experience some form of lower back pain, and they have the choice between going to somewhere where they can't really prescribe you anything anymore, or going to someone that's going to be able to adjust you and help you, to me, it's like, I think people are going to be choosing that chiropractic option more now.
They will. And research alone, obviously we know chiropractic can do tons of things, but you can't argue neck and low back pain. So it's one of those things. Even if that's what gets them in the door and you fix that, then the education can start. Then you can start poking around some more. So I've seen in my younger days, we've been practicing a while now, but you'd want to just tell any prospective patient, I can fix this, I can fix that, I can do that. And then I've learned over time, like, get them in the door, get them comfortable, fix one or two things that make sense, and then you can kind of open up. Then they're going to be like, wow, you fixed my low back.
Yes.
Check out this left wrist, or so that's pretty cool to see as well.
Yeah,
so.
no, I love adjusting extremities because every single time everybody's just like, you can adjust that? Like, I didn't know that could even be adjusted. And
it's funny. Extremities are, I enjoy them almost more than
I
adjusting the neck and back sometimes.
I love it. Well, and I think what I love most about extremities is the motor test with them, those relative motor tests where you can just easily test it. You see that joint dysfunction, you adjust it, retest it, and you're like, well, there it is. That joint lock is back. And to me, that's just amazing for not only me to see as the practitioner, but also the patient. They're like, oh, yeah, I couldn't keep my fingers closed, and now you adjusted my wrist, and I can hold them together now.
They're like, what's going on here?
Literally.
And also a lot of, chiropractors do it, but a lot just focus neck, mid, lower back, and then they're busy, high volume practices. But I always say I adjust the talus and the ankle and the wrist, and we use those all day. I'm like, how do you ignore that? You're on your feet all day, and you're using your hands all day, and nobody touches them. Right. So whenever I adjust that, patients are like, holy cow, I've never had that done before.
And they appreciate it a lot.
Oh, they definitely
do. Because like you said, I think a lot of practitioners typically will skip it because they might not see it as, oh, this is not a big deal, or they're not complaining about it. And me and you both know pain is always the last thing to come.
Correct.
Always first thing to go away, but
there's a lot brewing inside.
Exactly. So it's like, to me, it's just great to go ahead and take care of those issues before they turn into something.
Correct. Let's talk about some exercises patients can do. Just simple ones, because everyone always, again, wants a quick fix, and this is something not necessarily, it should be more of a daily type thing. So what are some things that people can do that maybe you're sitting for work a lot, things of that nature?
That's what I like to look into. I think, the dentist did a really good job at promoting dental hygiene for a lot of people. And me as a chiropractor, I want to start promoting more spinal hygiene. So using that time that we are doing some kind of dental hygiene, maybe use that extra little 5 or 10 minutes, go ahead and do a little bit of spinal hygiene. So one of my big go-tos always and forever is bird dogs.
Okay.
I love bird dogs because it helps to create that cross pattern back for the brain, getting that right shoulder to the left hip, the vice versa. To me, it just makes sense to have this coordinated X. And if you really think about even sports, for instance, a pitcher, they're throwing across their body, right? That hip is generating the power, and then the shoulder snapping the ball. So to me, that's where a lot of our power for even our upper can come from, is from the lower. So if there's this mix match going on, then that's when I'll start to see like a lower cross syndrome develop, or that can lead to upper cross syndrome, or both at the same time.
Yeah.
And to me, it's nice to have an exercise that can go ahead and start to counteract this forward flexion posture that we're always into, right?
Yep.
Learning all the way back to embryo, learning how the brain controls the flexion muscles of the body. The brain's always sending that signal to the front saying flex, flex, flex. Has to literally send a signal to the back saying, okay, flexion muscles, inhibit.
Cool off. Yeah.
Yes. Extension muscles, activate. Like that literally has to happen in this process. And if we're never sending that action to these extensor muscles, they never get that signal sent.
Sure.
And so eventually that signal gets less and less and less in the back, and these muscles on the front get overly developed, and we go back to that position that we were born in, fetal position, right? So to me, those kind of exercises like bird dog.
What about wall angels?
I do like wall angels for certain people. I do think they are a good thing for certain people. I'm a bigger fan at doing what I call W's, and that's using actual like a resistance band, elbows tucked in, and retracting the scapula. I tell people to like picture like a pencil between the scaps, and you're kind of just pulling back. That's always my go-to for that upper, because everybody's at a desk.
I was going to say, especially for people sitting a lot.
And then, dude, one of my favorites, because we're in Georgia, so you're not technically supposed to be on your phone driving, right? So one of my good things to be able to do to eliminate even looking at the phone, you get to our red light and you use that headrest as your resistance, and you just simply push chin into that headrest. Hold it 5 seconds.
Yep.
Let go. And that starts to just activate these posterior neck muscles to help keep the head up on the shoulders.
I
That
do
way
that
we're
in
not
bed. At bed at night on my pillow. Just push it back. Yeah.
Exactly. So simple, really just simple kind of stuff like that. To me, it's like we don't look at brushing and flossing our teeth as this, oh, I got to do this crazy. And it's like, no, it's this simple hygienic thing. And to me, those simple things add up over time.
You got to make sure you're doing it daily, not just when you're in pain or when you're feeling it. That's the whole point.
And I think that's the problem a lot of times is people are like, oh, I'm not in pain anymore. I don't have to keep doing this. It's like, well, that's how you got to get the pain to begin with. Because remember, pain is always the last thing to come, right? It starts with dysfunction and then the pain starts to come. So I think once people realize, okay, I can stop this dysfunction from happening, kind of continue a functional movement pattern, therefore can eliminate that chance of pain coming up.
Okay.
So that's probably my top 3: bird dogs, the W's, and the chin tucks.
I was gonna say, what do we call those? Chin tucks.
Chin.
Okay.
You know what I call them for the car? I call them my red light range of motions.
Oh, there you go. I like that. You should coin that one.
Yeah, I know,
like
right?
that.
Trademark, copyright.
All right, let's talk a little bit what it takes to become a chiropractor, because I get that question a lot. Just sort of like, how long did you go to school? Whether it's somebody who's trying to like feel us out, do we know what we're doing, or
mental fortitude is what it takes.
Yes, right. Gosh, or if it's somebody who's actually interested in becoming a chiropractor sometimes. But I found online, and I can't believe we did this many hours, but 4,200 hours of class, lab, and intern from year one of undergrad to walking across the stage. So kind of crazy to think about, right? You tell somebody that, and I feel like their eyes are going to light up, because I feel like some people feel like, oh, they went on YouTube and got a certification.
Well, yeah, and I think that's what a lot of people ask me. They're like, oh, so what was this, like a 2-year certification? I'm like, I wish. Like, no, I had to do undergrad. I had to do
Bachelor of Science.
Bachelor's. I had to do the 4 years of doctorate, So it took me almost 9 years to go from undergrad to getting my diploma of chiropractic and walking
and
across
that's the average 8-9 years. You tell people that, and they're like, holy cow. And I'm like, yeah, we kind of know what we're doing.
And what I had to tell myself when I was younger is the time passes either way.
Sure.
Either way, 10 years is going to pass, and I can be what I want to be, or it can pass and not what I wanted to be.
Sure.
So that's the way I had to look at it, because that can be, for someone that is considering becoming a chiropractor, like 8 or 9 years, like, I don't have that in me. And truth is you do, because the time passes by either way. But if you just look at it as time is passing, I'm using this time to learn and better myself. To me, it makes it more enjoyable.
It does.
I was never trying to rush through school. I went to school with a lot of other colleagues that were like, I'm just trying to get this done. I want to get out. And I'm like, I want to soak it in. This is the time right now that we can learn and make mistakes.
Yes.
And that's what I really wanted to use that time in school for. So I really didn't rush any of that process. I tried to enjoy it as grueling as it was from time to time. I saw the method to the madness. Like I'm really appreciative that we even had OSCEs before boards.
Sure.
Like that kind of little stuff. I'm like, going into boards, I felt prepared, like I got done and I was like, yeah, I'm pretty sure I passed.
I'm pretty good about that.
Yeah. So it wasn't like what was that? I have no idea. No, like I personally felt like our school did pretty good at preparing us for the load to come.
Yeah. So if you're thinking about chiropractic, you got a little trek ahead of you.
Absolutely.
But you can do it.
Yeah. Life you.
Yeah. Right. Gosh. Something everybody may not know, but actually every professional sports team, NFL, NBA, and MLB, all have their own chiropractor. So
I love that.
Yeah, what do you think about that? I think that's amazing.
I think it's awesome. I always love watching golf, and they just lay the golfer guy down on the ground and start adjusting him right there on the grass. I'm like, that's amazing.
Yeah, Tiger Woods, he swore by a chiro for a long time. Tom Brady.
And it makes a lot of sense, because these athletes are being drug tested, right? So there can be no performance enhancement drugs tested when they're going to compete, right? Chiropractic isn't a drug, right? All we're doing is simply relying on the body to do what it does and amplify that quality. So to me, why would you not want that? Like, okay, I can enhance my body, enhance my performance, enhance my ability to do this sport at my very best limit without disqualifying myself.
Sure.
Sign me up. You know, it's like no brainer.
I explained to high school athletes, we have a handful in our practice, and
I love this.
I tell them that I'm like, hey, the best are doing it. So why aren't you starting now?
Yes.
Like these are the top athletes in the world. and look where they're at, and look what they have to do. They spend as much time rehabilitating as they do training and building up muscle. So I tell them that, and they're like, holy cow, I didn't recognize that people did that.
They really don't, because it's a behind the scenes, right?
Sure.
It's a behind the scenes thing, and I think it's just like, you know, like the quarterback isn't necessarily going up to the top of the podium and be like, "Thank you, chiropractic. I wouldn't be here without you," which would be really awesome if they
I was
did.
gonna say, any
Tom
athletes
Brady,
out there want to call us out, please do.
Yeah. But you know, to me, even on a more of a level than that, I think it's important for all the athletes to get taken care of, because how many athletes actually make it to that professional level?
Very few.
How many actually get to that level of being the top athlete? Not a lot. Now, think about this number of years that you've dedicated to becoming the best. Maybe you didn't, but you still put in the time, you still put in the effort, you still put in this wear and tear on the body.
Sure.
And now you have to just live with, oh, I didn't get to make it to where I want to make it, and my body is screwed because of it.
Yep.
That's a lose-lose.
Sure.
At least win, lose, you know, like have a little win.
Wrap up your athletic career and be able to take on something.
Right.
But, if your body's in shambles.
That's my thing, is like, how many of these kids are going thinking, oh, I'm going to be the next, this, and they don't make it, right?
Yeah.
Oh, that sucks. But the truth is not everybody is going to be the next Tiger Woods. Not everybody's going to be the next Tom Brady, right? So we have to recognize that, and also say, okay, well, I still need to do the due diligence of what they did to repair.
Yeah, that's
the
a good
body.
point. I've never thought of it like
Absolutely.
that. Yeah. Let's talk a little bit about the future of chiropractic. A lot of things are changing. One thing.
Hopefully AI doesn't ever take it over.
I know, that's what I always joke about. All these jobs are getting snatched up. I was like, they better not teach a robot or something to adjust, right?
Teach the robot flying 7.
Yeah, and God, I don't even want to think about that. Let's talk a little bit about all cash practices, just because, you know, we obviously don't take insurance anymore.
Right.
Do you see the future of chiropractic heading in that direction? Do you see things changing, and maybe down the road we start taking insurance again? What are your thoughts on
if
that?
insurance changes its model,
Correct.
then yes.
That's my thought.
If insurance continues at the model that it's at, no. And the reason why is, I look at going to the chiropractor, like we were talking about the cars earlier, is going to get your oil change. You don't bring your Progressive, Geico, whatever, in to
Cover your
oil change, right? You're not like, hey, where can I go to get my oil changed? You pick where you go to get your oil changed, right? And that, to me, is the same with insurance, because a lot of times with insurance, they'll say, okay, well, you're approved for this person. Well, I don't like that person. Well, that's all we're covering. That's who you got to go to. Well, what am I paying you money for? I can just go pay this person directly to see me. And to me, it makes a little bit more sense to have this one-to-one contract without a middleman in between it. You
and
know?
all the paperwork.
You're right. You're coming in for a service. I'm providing the service. This is the rate of the service.
Yep. Clear cut, simple.
To me, whenever we start to bring in these middlemen, you got to pay them a cut, right? Like, oh, you're in this too? All right, here's your percentage, right? And I mean, I've heard some chiropractors getting screwed 10 years down the road because the insurance said, oh, well, we need this documentation from this procedure done years ago. And if you can't provide that documentation, they're coming for that money. To me, that's just a fear that no physician or chiropractor is going to want to have in the back of their head. Like, oh, am I dotting the I's and crossing the T's? I don't want someone 5-10 years later to come back and say, oh, we need this. So to me, going that cash, that one-to-one, hey, you're paying me for a service, I'm rendering the service, it eliminates any of that just stress.
Yep,
right?
and you see that in other professions as well.
Yeah.
PT offices are doing it. I've even read about a few just like urgent cares.
Dentists.
I haven't heard dentists, but just
Dentists
very
are starting
simple,
to move towards
straightforward.
that.
You pay a flat rate. They come in, examine you, write you a script if you need it, and out the door you go. Simple, no insurance, anything. So
I've even seen it in the medical model with like concierge medicine, where people will say, okay, this is my doctor. I pay him a monthly premium. He writes me my prescriptions, does my blood draws, does a visit, whatever. And that's
just
like
a flat rate.
And that's the flat rate, is a monthly thing. And to me, that makes sense for these like non-crisis things, right? Like, okay, the insurance to me makes more sense as like, oh, I just got my leg ran over by a guy on a bike or something and it's broken in half, and now I have to have this
that's
$20,000 surgery.
Sure. Catastrophic is one thing.
That's, to me, that's where insurance kind of makes a little bit more sense, these catastrophic type of things. Whereas, the day in, day out kind of things, to me, is more of an out-of-pocket kind of expense and not having to worry. And I understand, though, people, they pay a premium for insurance.
That's what I always try to level with them,
and they want to use it, and I get it. And I tell them, I'm like, hey, I have no problem. I will refer you to a chiropractor that will take insurance. I can't guarantee you're going to get the same quality that we're going to provide here, but I can get you there.
Yep.
And so that's really what that's what it takes for you to go see the chiropractor, is you using your insurance. So be it. But just know you might not be getting the best quality out of it, because that chiro is now having to do more paperwork. He's having to hire on someone else to do the billing. Like, there's a lot more processes that go in that I feel like can take away from the patient experience.
For sure. And to kind of summarize what you said, we do agree that it's going to be more cash-based practices in the future unless something changes.
Unless something changes. And that's where I see something could change. They could have a plug-in for the insurance where it's like, oh, you pay $30, $40 a month, whatever, for this type of maintenance thing. And this is, okay, these are the chiropractors that are approved, whatever. Yeah. It could get to that level or something like that. But with it being $700-800 a month for people, and
I don't see anything changing, at least anytime soon.